Hi, I'm Dr. Carine-Ange Tagni, founder of SiBelle Women's Health and Aesthetics, a medical practice here in the greater Philadelphia area. If you are a woman who is technically fine on paper, but you are exhausted, more irritable than what you like, and watching your body and skin change no matter how well you eat or how hard you try, and you're starting to think, I just don't feel like myself anymore, then this is for you. Maybe some of this sounds familiar. You look in the mirror and you think, I just want to look a little bit more rested, but your skin doesn't seem to have the glow it used to. You're gaining weight around your middle area. Even though you're eating cleaner than ever, your sleep is broken, doesn't feel restorative at all, and your brain feels foggy all the time. You're snapping at the people you love, and intimacy, well, just feels different. Less desire, more dryness, less sensation. You do the right thing. You see your primary physician. They run a few basic labs and they tell you, everything is normal. You are just fine. You walk out feeling rushed, unheard, and thinking, if this is normal, then why do I feel so far from myself? So here's the part most women are never told. What's normal on lab report is not the same as what feels normal in your actual life. Your skin, your hormones, your sleep, your metabolism, your mood, pelvic pain, vaginal dryness, those are not separate issues. They are one interconnected system. And when that system gets out of balance, it shows up as all of these little not quite right changes that are easy to dismiss one by one. But hear me well. You are not losing your mind. You are not being dramatic. And you are not failing at self-care. What is happening is you are missing a comprehensive evaluation that actually puts the pieces together. That's exactly why we created our Women's Vitality Health Check. It's a $495 physician-led evaluation designed specifically for women navigating postpartum changes, perimenopause, and menopause, and who are tired of just trial and error care and 10-minute visits. So instead of guessing, Googling, and piecing together advice from 10 different places, we sit down, look at the full picture, and map out what's really driving your symptoms. Here is what happens when you book your Women's Vitality Health Check at SiBelle. Number one, we do a comprehensive intake and history in a calm, private setting that feels like a spa but functions like a clinic. We take time to understand you, not just when was your last period, but your sleep, mood, energy, weight changes, skin shifts, cycle patterns, intimacy, urinary changes, past pregnancies, surgeries, medication, family history, all of that. Number two, we do targeted testing, not random labs. We just don't run a basic panel and tell you you're fine. Standard labs are designed to catch clear disease, not to explain why you feel off. They often skip the very markers that matter most for women in this season, which are detailed hormones, metabolism, and inflammation panels. With our Women's Vitality Health Check, we focus on the specific biomarkers that line up with your symptoms, so we can see what's actually changing in your body instead of stopping at she doesn't have any major illness. Number three, physician-led results and explanation. In your follow-up visit, I walk you through your results in plain language. I connect the dots between your symptoms and what we see in your labs and exam, so you will finally know why you feel the way you do. Number four, personalized vitality roadmap. You will leave with a detailed plan for the next 90 days. What needs attention first? Where hormone therapy, metabolic support, and intimate care fit in. What to stop wasting time on. What habits to consider shifting. This is not an endless string of appointments. Our goal here is clear: restoration. So you can wake up refreshed, move through your day energized, and trust your body again without constant second guessing. Women who come to SiBelle usually say some version of, I'm not sick, but I definitely don't feel like myself these days. I've been told everything is normal, but I know something is off. I feel like my body and my life just don't match. But after the woman's vitality health check, what we hear is, for the first time, someone actually listened and explained what's happening. I finally understand my body instead of being afraid of it. I feel seen, not brushed off, and as their plan unfolds, better skin, better sleep, better mood, less brain fog, more pleasurable and comfortable intimacy, and a body that feels like home again. So you might be wondering, am I too young? Well, if you're in your 30s or 40s and you're noticing real changes, you are not too young. Perimenopause can start years before your period stops. Is it covered by insurance? The Women's Vitality Health Check is a cash-based service. We chose this model because we cannot give you unhurried, thorough care inside the constraint of a rush insurance visit. Many women decide it's worth it to finally get clear answers. So what if my labs are normal again? Then we look deeper. We correlate your results with your symptoms, not just a reference range. You still live with language, insight, and a plan instead of "you are just fine." Is this just about hormones? No. Hormones are a piece, but not the whole picture. We look at your skin, your sleep, your metabolism, your pelvic health, and intimate wellness. They all interacting, so your plan actually addresses your symptoms. The Women Vitality Health Check is for women who are ready to stop being managed by the system and start leading their own care. This is for you if you've been told everything looks normal, but your body is clearly telling you otherwise. You are tired of the 10-minute visits where providers stick to a template instead of actually listening to you. You don't want reactive care that waits until something is bad enough to treat, and you want to be proactive before you hit a wall. This is for you if you believe you shouldn't have to beg for deeper testing or repeat yourself just to be taken seriously. If you're ready to advocate for yourself and want a physician partner who welcomes that instead of pushing you back into the system's norms. If you're hoping for a dramatic, instant makeover or one-time miracle, this isn't the right fit. But if you want to take charge of your health, get a clear, grounded understanding of what's happening in your body, and follow a personalized plan that helps you feel like yourself again over time, then this is the place to start. So if you're listening and thinking, that's me, I don't feel terrible, but this cannot be my new normal, the next step is simple. Click the button on this page. Book your Women's Vitality Health Check. We conduct it virtually or live in person. Just pick the location you prefer when you complete your booking form. Should you decide to do yours in person, you will walk into our discreet, judgment-free medical clinic where there's time to talk, space to be heard, and a physician who takes your concerns seriously. And if you opt for virtual, we will meet via a secure conference line where there's time to talk, space to be heard, and freedom to share your concerns with a board-certified physician ready to help. You don't have to white-knuckle your way through this season or accept "you just fine" as the final answer. If you're ready to feel like yourself again, I will be honored to begin that process with you at your Women's Vitality Health Check. Click the button, book your appointment, and we'll see you soon.